Dr. Nessim here, and I was actually just about to go to bed, but had to make this video because Kyrie Irving of the Dallas Mavericks just suffered a knee injury while driving down the court. This looks like it might be an injury that keeps him out for a little while, and Mavs have had a streak of bad luck when it comes to injuries lately, so I feel bad for them. I feel bad for Kyrie in general, but let's take a look at the injury and see what might have happened. So as you can see, Kyrie jumps, he hits the leg of the other player, which initially that probably was more just a bone bruise, but then look what happens when he plants his left leg. So he plants and clearly hyperextends his knee, goes down immediately. So we'll watch it again. Hits the defender, which throws off his gait, steps, hyperextends. Yeah, so I mean, we're looking at definitely some ligament damage. Now, meniscus can get damaged there. When the meniscus is basically the cushion around the knee. ACL, it's possible, but usually when you think of an ACL injury, it's a non-contact where you plant and then you feel that ACL go. He technically could injure the PCL, the posterior cruciate ligament, but usually you see that in like car accidents or in someone that's electrocuted is the classic board question you'll get for PCL injuries. Really any of these ligaments could have been damaged here. This was a very strong hyperextension, and so I'm certain he'll go get an MRI, and then we'll be able to see what actually happened. Either way, he'll be out for at least weeks. If there's a significant ligament tear, he's going to need surgery. He will be out for the season. Impressively, he stayed in to shoot the 2 free throws, even though you could tell he was clearly in a lot of pain. I believe he made them both, and so that was good to see. The fans gave him a standing ovation, but I don't love what I saw from that injury. That was a pretty significant hyperextension, and so could it be an ACL injury? It definitely could be PCL, although less common. Possible meniscus damage. You could have a tibial plateau damage. I'm sure he'll get x-rayed as well to see if there's any possible fracture because of the amount of force that was coming down on the tibial plateau, as well as the patella, which could also in certain hyperextension injuries get dislocated. It didn't seem like that's the case here, but these are all the things that the medical team will be looking out for, and we will just have to wait and see what the ultimate reports will be. If you like this type of content and want to keep up to date on sports medicine injuries, please subscribe, like the video. It means a lot, and I will see you in the next video.